2020-2021 Coronavirus Disease 2019 is a contagious disease caused by severe acute respiratory syndrome coronavirus 2. The first case was identified in Wuhan, China, in December 2019. The disease has since spread worldwide, leading to an ongoing pandemic. Symptoms of COVID-19 are variable, but often include fever, cough, fatigue, breathing difficulties, and loss of smell and taste. Symptoms begin 1 to 14 days after exposure to the virus. Of those people who develop noticeable symptoms, most, and 5% suffer critical symptoms. Older people are more likely to have severe symptoms. At least a third of the people who are infected with the virus remain asymptomatic and do not develop noticeable symptoms at any point in time, but they still can spread the disease. Around 20% of those people will remain asymptomatic throughout infection, and the rest will develop symptoms later on, becoming pre-symptomatic rather than asymptomatic and therefore having a higher risk of transmitting the virus to others. Some people continue to experience a range of effects, known as long COVID, for months after recovery, and damage to organs has been observed. Multi-year studies are underway to further investigate the long-term effects of the disease. The virus that causes COVID-19 spreads mainly when an infected person is in close contact with another person. Small droplets and aerosols containing the virus can spread from an infected person's nose and mouth as they breathe, cough, sneeze, sing, or speak. Other people are infected if the virus gets into their mouth, nose, or eyes. The virus may also spread via contaminated surfaces, although this is not thought to be the main route of transmission. The exact route of transmission is rarely proven conclusively, but infection mainly happens when people are near each other for long enough. People who are infected can transmit the virus to another person up to 2 days before they themselves show symptoms, as can people who do not experience symptoms. People remain infectious for up to 10 days after the onset of symptoms in moderate cases and up to 20 days in severe cases. Several testing methods have been developed to diagnose the disease. The standard diagnostic method is by detection of the virus nucleic acid by real-time reverse transcription polymerase chain reaction from a nasopharyngeal swab. Preventive measures include physical or social distancing, quarantining, ventilation of indoor spaces, covering coughs and sneezes, hand washing, and keeping unwashed hands away from the face. The use of face masks or coverings has been recommended in public settings to minimize the risk of transmissions. Several vaccines have been developed and several countries have initiated mass vaccination campaigns. Although work is underway to develop drugs that inhibit the virus, the primary treatment is currently symptomatic management. Involves the treatment of symptoms, supportive care, isolation, and experimental measures. Symptoms of COVID-19 are variable, ranging from mild symptoms to severe illness. Common symptoms include headache, loss of smell and taste, nasal congestion and rhinorrhea, cough, muscle pain, sore throat, fever, diarrhea, and breathing difficulties. People with the same infection may have different symptoms, and their symptoms may change over time. 3 common clusters of symptoms have been identified. 1 respiratory symptom cluster with cough, sputum, shortness of breath, and fever. A musculoskeletal symptom cluster with muscle and joint pain, headache, and fatigue. A cluster of digestive symptoms with abdominal pain, vomiting, and diarrhea. In people without prior ear, nose, and throat disorders, loss of taste combined with loss of smell is associated with COVID-19. Most people and 5% of patients suffer critical symptoms. At least a third of the people who are infected with the virus do not develop noticeable symptoms at any point in time. These asymptomatic carriers tend not to get tested and can spread the disease. Other infected people will develop symptoms later, called pre-symptomatic, or have very mild symptoms and can also spread the virus. As is common with infections, there is a delay between the moment a person first becomes infected and the appearance of the first symptoms. The median delay for COVID-19 is 4 to 5 days. Most symptomatic people experience symptoms within 2 to 7 days after exposure. and almost all will experience at least one symptom within 12 days. COVID-19 is caused by infection with the severe acute respiratory syndrome coronavirus 2 virus strain. Coronavirus disease 2019 spreads from person to person mainly through the respiratory route after an infected person coughs, sneezes, sings, talks or breathes. A new infection occurs when virus-containing particles exhaled by an infected person, either respiratory droplets or aerosols, get into the mouth, nose, or eyes of other people who are in close contact with the infected